We finished 22 cities in a week's time, traveled 2,000 miles, great reception wherever we went to, lots of good feedback, people calling me every day now asking if I'll come meet them and talk with them and share our story with them. So I'm excited. What I've learned in my life, whether I'm leading a church or leading a Rotary Club, which are volunteers, or leading a corporation, is that if I genuinely listen and respect to other people's views and use their ideas to help us find a better solution for everybody, that we get much better buy-in. So what I'm going to be really good at, I think, is having genuine respect for your opinion, identify the problem clearly, leave the things we disagree out of the way. Let's figure out what the goal is for this country and for this state, and let's move in that direction and leave some of our personal differences aside. I think number one, as I tour around the communities, I think is probably education. I just had no idea how important Kansans think education is. So unfortunately, what I hear mostly about is the state budget issues probably. I think on the national level, what I hear more about, though, is just government overreach. Whether you're in farming or banking or insurance, no matter what business you're in, there's just a big concern about government overreach. I think my job as a leader is always to make the complicated simple. So I think whether we're addressing the Affordable Care Act or Dodd-Frank in banking, no matter what the issue is, my job is to make it simpler and more understandable and more user-friendly. So I think if it's medicine, I'm going to try to make that simpler. I think those would be the basic tenets. If we can make it simpler, then I'm excited. Okay. I think we have to find the good in it, keep the good, and get rid of the bad. So there are some things that physicians and hospitals have liked. We would like to get people out of our emergency rooms that don't have health care. There are so many people that don't have health care. 40 million people in the country when we started this didn't have health care. Now we're down to 30 million people. That's the good news. The bad news is they have an insurance product that is really not usable. It's over $5,000 deductible. It's the platinum plan as opposed to the gold plan. So they are able to get the insurance, but the people that purchase it cannot afford a $5,000 product. But we need to try to somehow get those people on some type of health care plan rather than getting free care in the emergency room. I think the other good thing about the Obamacare plan was that people that have problems getting insurance because they have a health problem and they're part of a small business, they're unable to get insurance. So that was a good thing about it. The bad thing is it just creates more layers and layers and layers and layers, and physicians are just so tired, and the hospitals are. I've had to add in my own office 2 new nurses since starting Obamacare, and we're not seeing any more patients. Speaking on the hospital behalf, we've had to hire, I can't tell you how many more people that are not having direct patient contact, so somehow we have to get rid of the bureaucracy of it. And I think lastly I would say, as everyone knows, our insurance premiums are still going up despite Obamacare, so we have to get to the bottom of that somehow. I think bringing healthcare back, healthcare is so different in Miami, Florida than in Great Bend, Kansas, or in Hays, Kansas for that matter. We have to be able to get each state figuring out how to do their own health care. Any health care plan born out of Washington I don't think is going to work well. I am much more of a free economic person, would rather let the markets figure out. I don't think a single payer will work at all, and we'll end up with socialized, you're talking a socialized medicine program like England and Canada, which have long waits and not very efficient.